Good morning. This is Dr. Renfro. Wanted to go ahead and record this patient orientation class. We call this health success class for some of our patients who are not able to make it in the office right now. The purpose of this talk is to discuss what health is, where it comes from, how do we get it back when we lose it, and how to get the most benefit from your care. We want to talk about the difference in healthcare models, the difference in what we do in this office versus what and why other things are done in other healthcare settings. We want to talk about trauma, stress, and toxins, how these contribute to spinal neglect, how that leads to poor health, and things that we want to avoid moving forward. Ultimately, I want to give you some quality information that will help you possibly make decisions in the future about your health. Don't want to try to convince you of anything or tell you what to do, but it's always better to have more information to make a more informed decision. So I usually ask people for permission to move forward with the understanding that I'm probably going to say something that they disagree with or that might quote unquote step on their toes. Obviously, I don't mean to offend anybody. I'm just um, discussing what I know based on my education, based on my experience, based on my research, and based on the clinical outcomes from chiropractic practice over the course of more than 125 years now. So we'll move ahead and I'll just talk about why I'm here, why I do what I do. My story is that as a kid growing up, I was sick in one way or another pretty much until the time that I was 24 years old. I don't say that to mean that I'm special or different than anybody else. That's just commonplace. That's what's common in this society is that people are sick with one thing or another during most of the stages of their life. So when I started out, it was ear infections as a kid. I went through antibiotics and they put tubes in my ears. And I believe that, from what I've been told, that they ended up putting tubes in my ears 3 different times, along with antibiotics and things like that. And that was not necessarily the answer to my ear infections. Later on, I would get sinus infections. I had chronic runny nose, bacterial infections. I was the snotty nosed kid at the elementary school. There just were not enough tissues for me. And so I would resort to just wiping my nose on my shirt. I had a raw nose all the time. It was really quite embarrassing, but I didn't know what to do about it. We had been to the doctor, we had had antibiotics, we had done all these things. Um, I would also get strep throat at least once a year and be sick another maybe 2 or 3 times per year. Not to say that that's abnormal, but that is something that just about every year at about the same time of the year, I would get strep throat. My tonsils would swell up, and I couldn't swallow anything for a few days. We'd go to the doctor, get antibiotics. I'd take them for a little while, and then get better, but the next year the same thing. Oh, it's strep throat again, 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 again. When I was in my teens, I was diagnosed with a condition called attention deficit hyperactivity disorder, and so this was I was of the generation where they this was starting to blow up and become more and more common. And so what I understood when they diagnosed me was that, there was a problem. I was not normal. I was not like the other people in school. And that meant that I had problems academically, and I couldn't survive in that environment unless I had special accommodations and unless I took the pills that they gave me. So the most common medication at that time for this condition was maybe Ritalin. I ended up on something called Strattera shortly after that, or around the same time. A drug called Adderall was coming onto the scene, which is still in wide use. Well, anyway, despite that, I took the medication as it was prescribed um, for a good while, and I never it didn't help. I was not able to academically perform any better, and I felt worse really on the drug. And so I just gave up on that. And when you give up on that, all you're left with is the diagnosis is just a black cloud over your head that says that you're not smart enough, you're not good enough, you've got this problem. And so that followed me through the rest of my educational career. And I was probably average, if not a little less than average. Not that that's a bad thing. I just didn't have any confidence in the academic environment, despite the fact that there was, you know, no reason why I shouldn't have been able to do those things. So when I was 24 years old, I ended up in a chiropractic office for the first time. I didn't end up in a chiropractic office based on neck pain or back pain or headaches or anything like that. I just ended up based on the recommendation that it would help my health overall. And these were coworkers and a family member who had suggested that I check it out, look into it. And so I put that off for a little while, but finally ended up looking into it. Finally got it into the office. And then finally, about 2 months, a little more than 2 months into care, started to realize that I felt better, but I didn't just feel better physically. I felt better mentally. Like I was able to learn better, recall better. My head was clearer. I felt better in multiple ways. And so I wanted to know, did this have anything to do with the chiropractic care that I was under? Because that was the only change in my lifestyle that I had made within the recent past that could account for that. So I started to research, look into chiropractic, the different techniques, what all people do, and then what kind of results the chiropractors are seeing in practice. What kind of things are they reporting? And I started to read this stuff about kids with things like ear infections and colic and other types of common childhood conditions, and how they responded very well to chiropractic care. I started to come across things about chiropractic and the relationship between the nerve system and the immune system. Not that chiropractic is something that's used as a treatment for the immune system, but that whenever the nerve system functions better, that allows the immune system to um, uh, function better. And so it was no wonder that since the time that I was 24 years old and I got under care and got some of the damage in my spine addressed, that I have not had strep throat since that time. And as well, I was able to actually go back to school. I got passionate about this. I felt better. I was able to academically apply myself better, and I pursued a career in chiropractic because of that and because of the change that it made in my life. And that's what I wanted to do for other people. I wanted to help them in this way that I had no clue about before I came across it. I think that most people are the same way. They just don't know what it is and how it can help them. So after I found out all this and had this experience, I put the 2-week notice in at my job, and within 3 months, I was living in Atlanta, Georgia, and doing the academic work for the prerequisites to get into chiropractic school. And this was 4 years later at graduation, and I was emotional here. And this is my great aunt and uncle, but I was emotional because I wasn't supposed to be able to do that. And I didn't believe that I could do that. And I had no plan of doing anything like that, but my life changed drastically. And that's very dynamic to me in a way that I wanted to be able to help people to discover um, how much how much really chiropractic does have to offer. So let's talk a little bit more. I like to ask people, do these uh, what do these symbols mean when you see them when they light up in your car? We've got one up here. This is usually the check engine light, and this one down here in the bottom left is the warning light, of course. And by and large, most people say, okay, when those come on, you got a problem. You need to take the car to the shop. And that's true. That's definitely what we want to do. We want to take the car to the shop. But sometimes I'll give it a little bit of time, because sometimes the light will go off again and then nothing will happen. So sometimes the light comes on and there's a problem and you need to go to the shop. Sometimes the light comes on and then it goes back off again and maybe there was no problem. I always ask people, could there be a problem with the car and the light not come on? And the answer is yeah, there could be a problem with the car and the light not come on. Or there could be no problem with the car and the light comes on. So there is a world of different possibilities there. And what we're speaking to here and what we want to talk about is that the relationship between this idea and our healthcare system. Let's go down. So our current model of health, or our current healthcare system, is based off of one overarching idea. And this is how our society has been taught to function in relationship to doctors and treatments and seeking healthcare advice. And for the most part, it's based on symptoms. So what we learn, what we've been taught is that if you have symptoms, then you must be unhealthy. At the same time, if you don't have symptoms, you must be healthy. And so the objective of our healthcare system, by and large, is to relieve symptoms. Now, it's not just that simple. I know that there's a variety of conditions and illnesses, but what those are groups of symptoms that are basically interpreted and diagnosed, or they're given a name so that they can be treated in whatever way has been determined needs to be, that condition needs to be treated. But it all comes down to symptoms. So what is the symptom? There can be a big problem with this. And it's no secret that the US healthcare system is not a perfect system. We'll talk about that as we go along. The main problem is that judging your health by how you feel is going to tend to introduce problems. It's not the whole story. You could be pain-free and you could be symptom-free, but you could be absolutely unhealthy. Okay, so when we judge our health based on how we feel or the symptoms that we're experiencing, a lot of times we're going to miss the mark, and it's going to come back later on. And when we talk about this, we just give the example. Okay, so you take some of the leading causes of death in this country. Heart disease is still number 1. Cancer is still number 2. Stroke is number 5 now. But look at all of these conditions, and they don't have any early symptoms. They don't have any early warning signs. They are in the making within the body for years and years before the first symptoms ever occur. And so people who die of a heart attack or cancer that has developed to a point where the treatment's not going to help it. Sadly, the individual, they didn't catch it in time, right? Because we base our health on symptoms and how we feel. Stroke the same way. So you can't base your ideas on your health and healthcare solely on symptoms. Some symptoms can be good things as well. So examples of healthy pain or symptoms are, well, if we eat something bad, we're going to throw up, right? And most people think of throwing up as being sick. And it's certainly not something that's fun to have to go through, to eat something that's bad and then to experience the vomiting. But it's entirely a healthy response of the body. And what it is the body's mechanism for getting poison out as quickly as possible. Not just poison, but anything in a quantity that's going to be harmful to the body. So if you eat something bad, if you drank too much, if you ate too much, or something that was rich, or something that had bacteria growing on it, your body is going to eventually, under healthy circumstances, if it's functioning normally, it's going to identify that as a stressor or a danger internally, and then try to get it out. A fever is the body's way of maintaining its internal temperature to maintain the level of bacteria and viruses within the system. And I say that because bacteria and viruses live inside of the body and are a part of a healthy, what they call like a biome. And so the body uses certain mechanisms to regulate those levels normally. And so if it determines that they've gotten out of balance, then a lot of times the fever is the response. What we've been taught is that a fever is a bad symptom. We need to try to take a over-the-counter medicine and kill the fever. And a lot of times that'll prolong the illness because the body's already doing what it needs to be doing by creating the fever in the first place. Touching a hot stove, you know, we're dead set on going through life without experiencing any kind of pain. And so we've got a wide variety of very effective pain killers, pain relief, a lot of this pharmaceuticals type stuff. But under many circumstances, we need to feel pain so that we can change. So if I touch a hot stove, I need to feel the pain so that I can pull my hand away, so that I don't incur any more damage than is absolutely necessary. And that's just one example, but there's many examples by which pain is a good thing for us to experience temporarily. A lot of times pain is like a warning light for the body telling us that we need to do something different or that something internally is wrong. But only about 25% of the nerve system is capable of sensation and actually registering pain, and the other roughly 75% is going to be dedicated more to function. And so you're much more likely in the occurrence of spinal degeneration affecting the nerve system to experience a functional symptom rather than a pain type symptom. I'm just saying, people always ask why their spine has been able to degenerate to the place where it has, and they didn't have any pain. Well, that's why. Pain is not entirely common with spinal degeneration and the spinal health phenomenon. Another deceiving factor is, that people think that chiropractic care is for pain. It's really not for pain. It's for the health of the spine, whether there is pain or there is not pain. So a big question here is, how do we define health? And there's no one set way. Different sectors of healthcare look at it in different ways. In general, our healthcare system bases health on the absence of disease, pain, and/or symptoms. But there's also the need for complete physical, mental, and social well-being and normal function. It's just that those two things are not usually the basis for disease and infirmity treatment. Once again, when we define our health based on the absence of disease or pain or symptoms, we miss the mark. The same thing as we were talking about earlier. In general, our medical system, though it is the most advanced, we have the best drugs, we have the best doctors, we spend the most, it is the effectiveness of that system is hampered by this singular view of health. In general, the medical approach is going to treat the body as individual parts rather than as a whole. This is called reductionism. So they take an individual and they reduce it down to whatever part is having the problem. In general, they're going to treat the symptoms. It's not really based on a principle of health. It's more based on a principle of analyzing and diagnosing symptoms. And then the healthcare approach is very closely related to the insurance and the other economic aspects of healthcare that complicate everything. We have a very hard healthcare system to navigate in terms of the money aspect of it, because so many people have an interest in it. And it's not based on what's in the patient's best interest. A lot of times it's based in what's in the pharmaceutical company or the insurance company's best interest. And that brings us to that healthcare economics, very complicated. Just briefly, 80% of the budget of healthcare is spent on marketing. So before somebody ends up in a doctor's office to ask for a drug, they've probably seen a commercial on TV. And so we've gotten very used to these types of things. We spend a lot of money on things like drugs. So in 2018, Americans spent about $535 billion on drugs, and that's a 50% increase over 2010. Part of the issue here, and it's not like it's a secret that the pharmaceutical companies are like this. It's just that we've been conditioned into this system of healthcare where basically there's well, I like the way this puts it. Part of the problem is that there is more profit in a pound of cure than an ounce of prevention. We are in a reactive system that's going to react to healthcare crisis instead of prevent a healthcare crisis. And like I said, we spend more on healthcare. We, as Americans, we spend nearly twice as much as the average country, but we still have the lowest life expectancy. We have the highest chronic disease burden. We have a very high obesity rate. And so this healthcare system that we have that in this country, even though we have all of the best of everything and we're spending the most money, we're not really getting the health return on it. It's not making us any healthier. In terms of where we're at on a level of total health index with other countries, we're about 30th out of 93 countries. And the reason we're 30th is because it's just a one-sided system. It's based on symptoms and then the economic complicating factors. We spent 3.6 trillion on healthcare in 2019, but we're still 30th out of 93 countries. And so it's not all doom and gloom. Our healthcare system is definitely the best crisis care system that you're going to see throughout the world. And what that means is that if I'm in an accident, a car accident, we have the best system that'll get me the crisis care that I need to save my life. And that's very important. And that's what we're really good at. What we're not good at is getting people healthy and keeping them healthy. Economics also factors into that. A sick patient, a patient who gets well is not worth anything. So a patient who is continuing to circle through the system is going to generate a lot more profit for more people along the way. A website here that would be good to check out would be truecostofhealthcare.org, and that just has a lot of information. I think it's reliable. I wouldn't take it as the gospel truth, but it is a perspective on this. The insurance company is very similar. We want to ask the question, is their mission healthcare and the patient, or is it profit? And if you look at it, and if you look at it realistically, they have a bottom line, a profit margin, and that's what everything that they do is about. It's also based on symptoms, so it's not truly based on providing people with health. It's about treating the symptom, whether or not that means that they get healthier or that the symptom is continued to be treated for years and years and years and generate thousands and thousands of dollars in this system. The insurance model is going to tend to dictate patient care because they're going to tell the doctor what to do for the patient instead of the doctor determining what the patient needs. And so it almost takes the healthcare expertise away from the doctor and just makes the doctor the middleman for generating the dollars for the system. It's also a competitive model. Like I said, anybody who gets well doesn't represent profit within that system. And so it's going to tend to not cover things that go outside of the traditional healthcare realm, and chiropractic has certainly been one of those things. The trend is to cover less and less. Most companies aren't going to cover for any type of corrective care. They're just going to cover manipulations based on symptoms. And so it's just a very, very hard model to get your health back. It's a hard model to have chronic illnesses in. It's a hard model for people who don't have enough money to be in the model. And it's very unfortunate in that way. So in terms of our perspectives on healthcare, this office and myself especially are a lot different than the traditional views on healthcare that I've just been considering. And I like this meme a lot, and I hope that I can, anyway, well, let's take a look at it. So this is Kermit the Frog, and he says, when you're taking a test and everyone starts using a ruler, but you thought the answer was Abraham Lincoln. And he's just kind of looking around like he's sitting in class. And this was kind of this is probably my experience throughout my school days. We have a different perspective than this traditional healthcare model. And so I want to introduce that to you, and I want to help you understand why we do what we do in this office. Probably the question that I would ask, after looking at all this information that I've just given you is, what causes health? If our healthcare system is based on sickness and disease, and if it's not truly providing people with health, then where do we go to find health? How do we get healthy? What is it that we need to be doing in our lives to cease being reactive, to stop waiting to get sick and get sucked into this system, and being proactive and taking care of ourselves over time, so that we don't have to break down, so that we don't have to have these healthcare crises and end up in this kind of predatory system. So what causes health? And what limits our body's ability to be healthy or to function normally? And so to talk about that, we want to talk about anatomy, and we've been through some of this. If you've been a patient for any amount of time, we've already discussed some of this stuff. What I always ask people is, what organ is the most important organ in the body? Some of the most common answers are the heart. A lot of times people say the lungs. But what we're going to argue right here and right now is that it's the brain. It's the brain. And you got to think about it. By design, the brain is the only organ completely and totally encased in bone. We were designed, that brain is so important that it's got its own built-in case. It kind of floats in a fluid called CSF, and that absorbs shock, and that brain protects it from injury. The brain also controls everything else in the body, and we'll talk about that in just a moment. And you think about it, if you don't have a brain, there's no life present in the body. How do they pronounce somebody dead? Is it when their heart stops beating? No, it's not. Is it when their lungs stop breathing? No. It's when the brain stops generating signals. It's when they can't register a neurological signal anymore. So the brain is the seat of life within the body. Then if the brain's the primary most important organ in the body, what's the second most important organ in the body? Well, it's very closely related to the brain. It's an organ or a system within the body called the central nervous system. And what that is the brain combined with the brainstem, which turns into the spinal cord, which branches into the peripheral nerves. And all of these peripheral nerves that you see in this picture here continue to branch and branch and branch and branch into trillions of nerve fibers that eventually connect all the cells of the body. Oops, dropped the microphone. Put that back up. Connect all the cells in the body back to the brain itself. And this is how the body is controlled. The brain has the blueprint. the body responds. There's signals that travel back and forth over the nerves, kind of like a telephone wire or the cable that connects the computer into the wall, or that connects the monitor to the computer itself. So that's the spinal cord that connects the brain and the body together. And that organ is also almost totally encased in bone. And if you know anything about the spine and the spinal cord travels through the inside of the spine. So it is also supremely protected. And so it must also be very important for the function and health of the body. We talked about spinal anatomy. We talked about the curvatures in the spine and how we look at the spine from the side, and we want to see certain curvatures in the spine. How when we look at it from the front, we want to see it straight up and down. We talked about the atlas vertebra, so that little 2-ounce bone at the top of the spine that your head sits on. Why they call it the atlas is because that was the figure from Greek mythology who held the world on his shoulders. And so when they started naming the parts of the body and dissecting people and giving him names, they named this bone the atlas because your world sits on top of that little bone. It holds your world up. It holds your head up. You see, inside of that bone is the brainstem. The brainstem is one of the first things that developed when you were in your mother's womb. After the sperm and the egg merged, the brainstem was one of the first things to develop from the notochord, the primitive streak, all of these things that developed into basically the nerve system, and everything else developed secondary to that. So it's still supremely important. This atlas vertebra makes up the craniocervical junction, or where the spine and the skull meet, and that's going to be one of the weakest joints in the body because of the relationship between the head and the spine, kind of like your body's trying to balance a bowling ball on top of a broomstick, but also because of the fact that, well, we don't have a big disc between the atlas and the skull or the bone below it. All we have are these two little layers of cartilage, and that gives your head the ability to turn 47 degrees to each side. So this is a very, very susceptible joint in the body to any type of trauma, any type of injury. Even if it's to another part of the body, a lot of times it's going to affect this joint. And when we affect the alignment of this joint, then it's going to cause imbalance throughout the body, both structurally and neurologically. And that structural and neurological imbalance is going to set the stage. It's going to set the stage to predispose you to certain conditions moving forward, certain pain patterns, certain degenerative patterns that will continue to affect you throughout the rest of your life. We talked about these discs in here. Okay, so we can see the disc, and it's like cartilage wrapped tightly around a little jelly pocket called a nucleus, and it's wrapped very tightly. And those discs allow the spine to move normally when it's aligned properly. But when the spine's not aligned properly and the spine's not moving normally, then the disc is going to degenerate, and it's going to go through stages of degeneration. And there's many stops along the way that can produce problems. Like this picture right here shows a herniation of a disc. And if you've ever heard of somebody who had a herniated disc, very, very painful. That's when the disc has become so unhealthy that jelly in the middle of it has ripped through the cartilage outer layer and shot into a part of the joint space, and usually it affects the nerves at that level. So what causes this problem? What can cause a injury of the spine that's going to affect the balance of the body and the nerve system, that's going to begin the degenerative process, that's going to affect somebody's health for years and years to come, and lay the foundation for the development of health problems in the future, both neurological, both structural pain, chronic pain, things like that? Well, most commonly, it's what we call trauma. And so that's accidents and injuries primarily. And so A lot of times it starts in childhood, and you can think about it. There's no shortage of the amount of accidents and injuries that children see. And after the bumps and the bruises heal, a lot of times what's left is spinal damage. We don't see the spinal damage. Nobody's checking for spinal damage. We're talking damage to the soft tissues that hold the spine together. When those ligaments become damaged, the spine misaligns by millimeters and degrees, so very small amounts, okay? The soft tissues can heal, but if the spine's still misaligned, then that body's stuck, out of balance. And most people go through their life out of balance, neurologically and structurally. So childhood trauma, playing football and sports. Football is actually not the primary sport that causes a lot of damage. One of the sports that they're starting to find out more and more about is soccer. And so much so that they don't let kids hit the ball with their head anymore because it causes problems. It causes, well, one thing that they call CTE, chronic traumatic encephalopathy, where it's doing damage to these kids. Practical jokes, falling off of bikes, things like that, falls and tumbles. Despite the fact that you wear a helmet, an accident or an injury falling off your bike or in sports or something like that still affects the spine. And so to not get a child's spine checked is like not taking them to the dentist until their teeth hurt. Just doesn't make sense. You're not going to do that. You're going to take them to the dentist so that they keep their teeth healthy throughout their life, so that they get the most life out of their teeth, something that they only get one of in their life. The spine and the nervous system is the same way. You only get one. Well, let's keep going. One of the most common starts of the spinal damage process is the birth process. And you take one of these babies who's maybe 7 to 9 pounds, and you take the average obstetrician who's about 170 pounds, and the average force exerted on that baby's neck, whether it's through forceps or a vacuum extraction or a vaginal birth or a C-section, that's going to be 70 to 90 pounds. And you're taking a baby who doesn't have the muscles developed to even hold their head up, and you can see why this can do damage. And it's not that any of these doctors mean to do that. It's just overlooked in the healthcare system, because our healthcare system is, for the most part, based on symptoms. It's also based on getting these babies out and getting another mother in the bed. So a lot of times the birth process can be the beginning of spinal trauma that will continue to snowball throughout time. And there's been a definite increase in childhood conditions over the years. Let's see, and then throughout time, throughout the adult's life, there's no shortage of the amount of injuries, falls, things like that. It's not just one thing, it's event after event after event. And unless the spine is specifically analyzed for this problem that we're talking about here, subluxation, and corrected, then it's going to remain, and it's going to affect that individual's health. It's going to decrease their body's capability to achieve normal health. Let's keep going. Even low speed, low impact car accidents. Of course, high speed accidents are very dangerous, but low speed car accidents can be just as detrimental to those soft tissues and the spine and the alignment of the spine and the nerve system. And the thing is that the effects that come from a low speed car accident or any of these things is going to be delayed in time, right? It's not going to cause the symptom in most cases for 10, 15 years, in some cases sooner than that, but in most cases 10, 15 years. And so we're talking these people will end up at the ER, they'll get an x-ray, they'll be given some meds, and they're told they're fine, there's no fracture or anything, you're fine. And then 10, 15 years later, they've developed this chronic condition. They end up in an office like this, and they say, no, when I had that accident, they told me everything was fine. And they just don't understand that they're not analyzing the spine for millimeters and degrees in alignment and effect on the nerve system. They're just analyzing the spine to make sure that you don't have a broken bone and that your head's going to fall off. So the effects are delayed. The symptoms do not come immediately. Other causes of trauma and damage to the nerve system, which is the reason why spinal damage is bad for you, is because it negatively affects the nerve system. It causes degeneration of the nerve system. Well, other things that negatively affect the nerve system and contribute to a decline in health or an inability to maintain or achieve normal health are toxins. And these are things that are pumped into our food, our medications, they're chemicals, they're preservatives, they're food coloring, things like this that do not belong in the body. They're not natural. They're not naturally occurring. And so our body is not designed to metabolize and to process these things. And any time it has to process these things, it comes at a cost. So any of this stuff that we can get out of our life is going to be drastically better for us, because we can take some of that burden off the body and allow it to start to function normally again, to start to metabolize, to start to detoxify. Talk about people who go on a detox. Well, why would you need to go on a detox? Because we're taking in so many toxins in our average daily life and in our diets and in our medication regimens that it becomes a huge burden for our health. And the burden is on the nerve system primarily. So when the nerve system can't do what the nerve system is designed to do and what it will do naturally, then it's not going to be able to achieve that normal level of health, that optimal level of health that you want to be at. And then we'll move down the line here, and stress is the very same way. And stress and emotional trauma and things like that have just as grave of an effect on our body and on our nervous system as accidents and injuries and actual physical trauma. You think about the guy that goes off to war and sees his friend blown up in a bomb. You think about the kid who was sexually abused, or I mean, there's just an endless number of possibilities. You think about the person who lost a spouse or a loved one, and this incredible stress, emotional stress, was such a burden on them that it affected them physically. And so our physical bodies are affected by the amount of stress that we're under on a large scale, but also on a maybe a more of a micro scale. How much stress you're under in terms of what you see in the society, what you're reading, what you're putting into your brain, what you're watching on the news, what you're listening to. All of these things are going to affect your health, your ability for your body to function normally. And in terms of the emotional trauma, that stuff is also recorded on the nerve system. And so a lot of times it gets stuck, played over and over. If the nerve system's not functioning normally, it's not going to be able to process. And so people get stuck in a loop where they're constantly reliving emotional trauma over and over and over again. And when their body is under intense stress from the environment, a lot of times that's what they will be replaying. And so we go into this defense mechanism where we're just gonna try to survive at all costs. So it's not just one thing, it's the accumulation of trauma, damage, accidents, and injuries over time that are going to affect our spine and affect our nerve system and decrease the body's ability to naturally achieve health like it was designed to do and achieve optimum health. And there's no amount of medicating or covering up the problem or trying to put things into the body that is going to help out any of this stuff. We have to take away and allow the body to function normally. We want to remove interference instead of trying to add more and more and more and creating more interference in the process. You know Christopher Reeve, Superman, and how he fell off of a horse and he broke the second bone in his neck right here, the axis. And basically, the function of all the organs in his body from there down ceased to function normally. He had to be plugged up to machines for most of the rest of his life to just breathe and eat and sleep and things like that. And then he ended up dying, much earlier than normal because of, well, on his death certificate was pneumonia. So his immune system wasn't functioning normally because of this damage and this trauma to the nerve system. So any damage and trauma to the nerve system is going to be drastic. And so why is that? Why is it that the nerve system is what we have to protect at all costs? Well, it's because the nerve system is controlling everything. It's basically the middleman in our body's function. And that's the middleman between the body and the brain. The brain has the blueprint for health, and it's running the show, and it's controlling the function of all these organisms through signals that pass through the nerves. And so those signals have to pass through the nerves, on the way to the organs, on the way to the cells, on the way to the body, and they have to be able to make it back to the brain without interruption or interference in the way of damage. So what we treat is something called subluxation, and that's basically that misalignment of the spine that is doing damage to the nerve system and affecting the way that the nerve system functions. And statistically speaking, most people have subluxation. Their spine is subluxated. It's not healthy. But our healthcare model is a symptom-based model, and so most people don't even realize what's going on nor who can help them. But most people with subluxation, they're going to have some type of pain or tenderness. We're going to see inflammation or swelling. We're going to see tight muscles because there's an imbalance of muscles. We're going to see locked joints or reduced motion of the spine because the spine's not aligned properly. And then we're going to see abnormal posture and abnormal heat because the spine's not aligned properly, it's not moving properly, and that negatively affects the tissues of the body as well as the nerve system proper, the nerves as they leave the spinal area. All of this has been researched academically on an academic level. This was a man named Dr. Chung-Ha Soo, and I believe this research was done in the 70s. What he said that was that the weight of a dime on a spinal nerve will reduce nerve transmission by as much as 60%. Now, I think it's like 10 to 60%, but still, either way, I don't want to have my nerves functioning any less than normal, especially the more and more I understand how important that is, how important it is to have my nerve system functioning normally. The AMA says the same thing that we're saying about people's health. They, just have a different perspective. They're saying that deviations in the body's center of gravity is going to lead to a variety of health conditions as well as overall poor health, a decreased quality of life, and a shortened lifespan. So we're saying the same thing here. This is a timeline of healing. We've gone through that in the office, so I'm not going to spend a lot of time right here talking about that. Let's talk about getting well, being successful in the office. And there's a few frustrations for patients and for myself that are going to tend to interfere with somebody's ability to get the result that they want to get in the office. Because we know that we can help individuals be healthier. We can help them get a healthier spine back. And in getting a healthier spine back, a healthier nerve system. And in a healthier nerve system, the function of their body becomes normal. And in a normal function, their health is able to regenerate. And so these are problems, frustrations. The first one is that a lot of people are going to put off getting a problem checked. And we call this the leaky roof syndrome. When it rains, the roof leaks and it's bad, and we say we're going to do something about it, but when it stops raining and the roof stops leaking, we just let it go again. But every time it rains, the roof leaks worse and worse and worse. And so as long as the cause of the problem is not being addressed, it's going to continue to get worse, especially when you're looking at internally in the body, degeneration of the spine and joints and the nerve system, only going to get worse. Again, this is another reason why we cannot base our health on the symptoms that we're experiencing at just one point in time. So the very dangerous words are, maybe it will go away. Another frustration is just covering up the problem with a quick fix. And we always tell people quick fixes are not realistic. There is no such thing as a quick fix. There's just no such thing. The Tylenol and the Advil, the headaches that you're experiencing are not a lack of Tylenol and Advil in your bloodstream. You weren't born with not enough Advil or Excedrin or anything like that in your bloodstream. There's a cause to that problem, and it's not going to, the problem's not going to go away unless the cause is addressed. Another frustration is the fact that we require patient cooperation to get the best results for people. we can't get people good results if they don't cooperate with what we need to get them that result. It's just like if you're going to bake a cake, there's a certain recipe, there's a certain timing, there's a certain ingredients. And anytime you skimp or that you negate any one of those things, your cake's not going to turn out well. And so we want to get the best result for people. And so it's very important for people to follow the recommendations. And then the last thing, or the two last things, are number one, people are in a big hurry. They want a quick fix. They want to get better now. But in terms of actually the body healing itself, and I'm going to tell you that the body can heal itself of anything, and the body has to heal itself of everything if anything gets better. But that takes a process. It's a process of time. It's going to take time. One healing cycle in the body takes at least 90 days. And so there's not much in the body that's going to happen at less than 90 days. And that's just being honest. That's just giving everybody a realistic understanding for what it takes to get better. At a minimum, it would be 90 days in most cases. And you cannot rush nature. Just like you don't want to rush that baby being developed in the womb. You don't want it to come out before it's ready because it's not going to be healthy. You can't rush the healing process. And then the fifth frustration is symptom treatment, and just, understanding that the symptom is not the same thing as the problem. So this beautiful city is Rome, Italy, and we always say that Rome wasn't built in a day. So we try to help people understand that when they start to realize that healing does take time. Rome was not built in a day, but your body can heal, and it will heal as long as the ingredients are there, as long as it stays in balance, as long as the degeneration and the damage in the spine is continuing to improve. So the nervous system is just so incredible. It's controlling every process in the body. It's controlling all these things that you don't have to think about. And you couldn't go to college to learn how to turn a carrot into an eyeball. You can't create a cell. You can't control your body's internal temperature. You can't digest things. You can't assimilate oxygen from the lungs and put it into the bloodstream and send it to cells to be constructive with. Your body knows how to do all this stuff. There's an intelligence internal to the body that you're born with, and that continues to operate and function as long as you're alive. So heart, lungs, digestion, temperature, all these things that are automatic are controlled by the nerve system. So it's so important for you to have a healthy nerve system. And if it's important for you to have a healthy nerve system, then you have to have a healthy spine to have a healthy nerve system. And an unhealthy spine is going to be the number one thing that causes a change in the way that the nerve system is going to be able to function, and a decreased potential of the nerve system to do what the nerve system does, which is control the function of the body. Your body's always building new cells, and what that is the process of healing. Healing is your body replacing old cells with new cells, and so your nerve system has to be functioning normally for your body to be creating healthy cells instead of cells that are less than healthy or not optimal. Roughly every 7 years, our body is a completely different set of cells. So you're always turning over cells. There's interference in the nerve system from a misaligned and a damaged spine, that none of these processes are going to function quite right. They'll continue to function. You'll continue to function in a way, but it's not going to be optimal. It's not going to be the best. It's not going to be as healthy as you are capable of being. So what we do is we remove the interference in the nerve system that's causing decreased function, so that the body can function normally again. And when the body functions normally, health is the byproduct of that situation. So even the Journal of Neurological Science says that the quality of healing or health is directly proportional to the functional capability of the central nerve system to send and receive nerve messages. So I want you to grasp this, and I'm going to simplify it. You're saying health is caused by your nerves being able to communicate, by your brain and your body being able to communicate, and communicate at the best of their ability. So when the brain and the body can communicate well, your health is going to be well. When your brain and body is communicating anything less than that, then your health is going to be gradually less and less and less. And so in terms of healthcare systems and health and nerve system and spine problems, um, you kind of got one way, you kind of got a few different routes you can take, but you got to deal with it now or later. So whether you have symptoms or you don't have symptoms, if there's damage in your spine, you can deal with it now or you can deal with it later. You can deal with it now in a conservative way, in a economically affordable way, or you can deal with it later in a less conservative way. Surgery is less conservative than chiropractic care. It's going to be much more expensive for that individual. It's going to be a much more impactful on that individual's ability to continue to move forward and function normally. And so there's a variety of just spinal surgeries here, which are more and more common. Unfortunately, a lot of the patients that we see have already had one or more spinal surgeries, and they're coming to us as a last ditch effort. In terms of chronic neurological conditions, most of these things are going to be related to neurological damage from spinal damage and misalignment. And so in one system, people are paying thousands of dollars per year to have these conditions continually treated, and they're not getting any better. Or we can address the damage in the spine, allow it to heal, and see a lot of these people get drastically better, if not drastically better, at least somewhat better. Any amount better than where they are at is going to mean more life potential, better quality of life, longer lifespan, more ability to be productive and to live a normal life. So that's what we're all about here. So let's see. The purpose of chiropractic, just to wrap everything up, is to remove interference from the nerve system. Any interference that we remove from the nerve system is going to translate into increased health. Removing interference from the nerve system allows proper brain to body communication. It allows proper cell replication and healing. It allows normal function, and that allows health. So where do you get your health from? It's the ability of your brain and your body to communicate. And there's only one thing that can allow your brain and your body to communicate better by correcting the damage and the misalignment of the spine that most people have, and that's chiropractic. And so it's just an incredibly valuable resource that we're continuing to learn more and more about and see more and more useful applications for within the healthcare world. But you have to understand that there's a difference between what we do and what the most of the healthcare world is doing, which is treating symptoms. So we've explained how we help you, why you need care, how not to undo it. We've discussed the 9-day healing principle. Healing takes time. It's very important to follow the recipe. The main thing is this. Okay, you're designed to be healthy. The body has the internal ability to heal itself, and it's got the internal ability to heal itself of anything. It just has to have the neurological potential to do so. And the most common reason why people are sick is because their nerve system is damaged. And the best way to help them is to get the nerve system functioning properly. So health doesn't come from a potion. It doesn't come from a pill. It doesn't come from the outside in, from anything that we put into the body. It's a natural response of the body through the nerve system. It's from above down into side out, we like to say. So thank you very, very much for your time. We'll look forward to seeing you at your next office visit, and we just appreciate you so much. Bye-bye.